it's Dr. Crocker again with Bree at Northwest Animal Hospital, and today we are going to try out a new product, Dr. Busby's toe grips. These are for arthritic dogs, and if you have one of these dogs, you will actually note that when they walk, they have a hard time gripping because they like to go up on their toes, and so they slide around, especially if you have wood floors or tiling, or floors like these. So our example dog today is Boudreaux. This is actually my dog. He is a 13-year-old male neutered lab, and he has been arthritic for about 2 years now. Originally just had him on joint supplements, and now he's actually on 2 pain medications, and starting to have a harder and harder time getting around my house. So I decided to do some research, and I ordered these, and this is actually the first time we're gonna put him on a dog, so you'll have to bear with us. First, I was just gonna show you kind of how he's moving and walking, and some of the things you could look for with your own pets if you feel like they're kind of having a harder time. So he will only walk on the carpet at home, and when he gets up, he's kind of stiff, kind of slow in the back end. He trembles a fair amount in the back end, and he's got some weakness. It's okay, bud. Come on, buddy. And he has a harder time on this floor itself. And then when he's walking, he loses his grip. So, you can stand up. There you go, buddy. It's okay. Come on, let's go. Come on, bud. Come on. There we go. But see how he goes up on his toes? And he only wants to be just like this on a carpeted surface. It's okay. You sit down. And he's much more comfortable when he has something that he can grip on. So that's why we're going to try the toe grips and see if it helps him out, because that's how he is in my house, and he now will only go in rooms that have carpet in them, which obviously makes things a little difficult around. So with these, I did watch the videos. They have some great tutorials online, and there's a couple things you do. You do want to trim the nail just a little bit, not a lot, and I've actually trimmed his nails fairly regularly, so we're not going to trim his nails any shorter. There's great handouts that they send you, and it basically shows you how to hold the toe, and then you just actually push these on, and the important thing is the grip has to be towards the end of the nail so it touches the ground. If the grip is too far up, it'll cause some pressure issues with the skin itself, and if it's too low and not touching it, then you're basically getting a useless nail art for your dog. So we are going to attempt this and see how they go. I did measure. They come in different sizes. And basically, you take some string and you go around the nail and you measure it, and then you cut it, and you can order the size that you need. So I got large and extra large because the back nails were a little bigger than the front nails, and we're going to kind of see what seems to fit best. To facilitate putting them on, you are supposed to soak them in a little bit of alcohol, and you don't have to do it for very long. So we just have isopropyl alcohol in here, and you might have that at your house. They also have it just at the pharmacies and grocery stores too, so you can get a little bit. And it says just to soak them in here just for a minute. If you have a dog that's very active still outside especially, you can add super glue right before you put them on, and that will actually help to have it stay on longer. But if you have a mainly indoor, what I call lazy lab that likes to sleep on the couch a lot, you don't need the super glue. So I'm gonna see how these larges fit, and basically once they're soaked, you're just supposed to pick it up and hold each toe, and then you slip it on there. And it says to kind of pull it back. Oh. So that's what happens when you're trying something for the first time. We're gonna try the extra large now, and let me see if I can maybe get that on a little bit better.
Changes of them. Do what?
It's a danger zone over
I
here.
know. I'm sorry, Christina. Christina, our lovely videographer, just got a little taste of the action there. Okay, so I have that on there. It's not too far back. You can still see lots of nail, and then I'm trying to still have it go on the surface. I think it might be that the extra larges are gonna work the best. I might have measured a different aspect of his nail. And we'll see too, the good thing is if these appear to just kind of come off too easily, then I will just go instead with the largest. Yes, you're being so good. I know. He's gonna get lots of treats after this today, which he already gets. Treats.
Don't food. No.
It is important with these guys to, and you don't have to do the dew claw because it's not one of the ones that is on the surface. And so most of these feel like when I put my finger on the bottom, I can have it touch the toe and the bottom. So let's do the other side. If you have a dog that doesn't like their feet being messed with, then obviously you're gonna need assistance and help. It is good to do what's called positive reinforcement. So if they like a certain treat or, you know, peanut butter or something, then maybe they get a little treat while you're doing it and while you're applying them.
You're being a good boy, Boo-Bro.
I know. And if anybody has put these on before, you know, this is definitely one of those learn as you go type processes. When we did the soft paws on the cat, I actually had a client say preload all of them with glue and put them on, and that has helped with other cats that we've done it with, just to have it ready, because obviously animals have a short attention span no matter how good natured they are.
Oh, you're a good boy.
Yes, you're being so good. Okay, so that looks pretty good. I'm not gonna do the back legs. I'll do that later. The front legs is where he kind of seems to have the hardest time. So let's see if we get him up, if he walks any different or not, or if he's down. Come on, Luna. Here, let me take him. Come on, let's go. I'm gonna go see. Oh, I like that. What do you think? So he does seem to be moving a little better. He wants to go outside. Come on, bud. Give him a treat. Good job. There you go. There you go. This is his sister Betty, so he wants to go back in with her.
Good boy.
But you can see that he's actually not spreading his toes out like he was. And when he is touching it, the surface of the toe grips are helping hit the ground when he moves and his feet contract. So he does appear to be a little more comfortable. Obviously, we'll have to see off a leash and at home if we get the same effect. Yes, you would. Yes, you were. So that was it. I'll maybe give you an update later in the week. We'll see if they stayed on, how he did with them. I might have to switch to the larges depending on how he does. Might have to play with the length of his toes. But it's definitely a learning process. But so far, so good. So thanks for watching. If you guys have any specific questions, let us know. We do not carry these in the hospital, but you can find them online, and we can always help with application if we need to. So thanks, guys. Have a good day.